The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by InMode Aesthetic Solutions.
Cardiovascular disease encompasses so many things. Today we're at Advanced Cardiovascular Care Center, and this is where I practice cardiology, and I've been here for about 20 years with my good friend Juliana Hurgoiu, and
Hello.
she is a registered nurse. She trained in the medical center here in Houston, and I found her at the Texas Heart Institute about 10 years ago, and she's been with me here at the practice for all this time. So we have a passion to teach people about coronary artery disease. So we're going to talk about that. Welcome, Juliana.
Nice to be here. I'm so excited actually, and I'm so happy that Dr. Varughese decided to do this show because I think her expertise and her knowledge is so important for the world, and I appreciate being with her for 10 years and what she brought into my life as far as my expertise and learning actually how to understand many things as a nurse and as a doctor because I feel like I learned so much that I can really say that what we're doing here is very important and is very advanced. As you know, our title and our office and our practice name is advanced. That stays behind Dr. Varughese, which is such an advanced doctor, and she can actually help all of us to learn how to live better and how to really take care of our health and understand the disease processes. So, Dr. Varughese, thank you so much for everything that...
I love it. I love it. And we're going to get started about teaching our patients, our friends, our worldwide audience, what is coronary artery disease, okay? It's kind of scary, right, when people hear about it, and sometimes they may have symptoms, but they don't want to get checked. We've seen it now in our last 10 years together and in my 20 years of practice. People may have symptoms, right? Maybe they're having some chest tightness or getting short of breath when they exert themselves, when they're walking or mowing the lawn or baking the bread or whatever they're doing, right? And sometimes women don't notice their symptoms because they're taking care of everybody else, right? So these are well-known facts, right? And we just want to get that word out to the people. Because what if they're having symptoms? What should they do?
Absolutely, and as Dr. Varughese mentioned, especially women, we have such a different type of symptoms than from men, and because we have so much endurance, and because we know for us pain is more like something that's usual, and we don't pay attention to it that much. It causes so much disease in women. Actually, I think that women has more disease than men in the
They
cardiovascular.
present later, right? And so then they do worse as far as outcomes. So it's so important for women to understand that they also have coronary disease. Men, of course, will come sometimes with their classic symptoms of they just ate a big old steak and they went out and it was cold outside and suddenly they had chest pain, right? That's the classic picture of a man suffering from coronary artery disease. But a woman, maybe she can't pick up her grandkids, or maybe she can't, do things around the house, or she can't go shopping as much as she used to, or whatever it is. So we want to get the word out that symptoms are important. But guess what? 50% of coronary artery disease patients don't even know that they have symptoms because why? They die suddenly. So sudden death is a huge part of what we see, right? As a cardiology practice, and we don't want to see that.
And that's why we're doing a lot of prevention with Dr. Annie. She can teach us how to actually take steps to prevent where you don't get into the disease where you can do much about it or it's too late. So
That's right.
I would like to ask Dr. Annie to tell us a little bit about the prevention that she does here.
Oh my gosh, prevention is it's our passion, right? I always say I trained at Texas Heart Institute, fabulous training, worldwide excellence in stenting coronary arteries, carotid arteries, aortas. We can stent anything, but we want to prevent that stenting by decreasing the plaque. Can we decrease plaque?
Yes, we can decrease plaque, and I think that many people don't understand yet what plaque is. but there is absolutely ways of reducing plaque and actually preventing to build the plaque. That's what we do here in our office. And Dr. Varughese, she's known to really be very aggressive when she's checking our patients out to make sure that they have just mild plaque and try to regress that immediately.
Right, and we can see plaque on ultrasound, right? So we do ultrasound here in the office. Easy to find soft plaque. So there's a difference between soft and hard plaque, right? So patients need to know that. Sometimes they'll go and they say, well, I had a CT of my coronaries and it showed that I had no calcium. I said, that's awesome. That means the plaque that you have hasn't calcified yet, right? But soft plaque can be there, and soft plaque breaks and it goes in bad places. And that's what causes heart attack and stroke. So we can check for soft plaque here in the office, right?
Yes, we do all kinds of ultrasounds, and maybe the audience there don't understand exactly what plaque is and how plaque formates, and just think about your pipes, like your arteries, just like the pipes of a sink. And we always make some analogy with simple things so patients can understand that if you pour a lot of fat and a lot of grease into your home sink, then your pipes are going to start to rust and they can break.
That's right. And that plaque grows, and there's something called oxidative stress that we'll be talking about. So you better follow us, because we're going to give you so much information of how this oxidative stress happens, how we can stop it and regress plaque. We can actually reverse plaque in this 21st century. So you need to know about that, because people do not need to suffer from coronary artery disease like they did, right?
Right.
Like parents and grandparents may have suffered. We don't need to suffer like that. So that's why we want to get the word out about coronary artery disease, plaque, and regression of plaque.
Especially if you have high history of cardiovascular in your family, and genetics are not always in your favor, just you have to know out there that there are ways to prevent and actually to help live longer, even though you may had some deaths in your family that were at younger age or so. So there is hope for all of us.
And easy way is to check their blood, right? I always say life is in the blood. So if we check the blood, we can look at inflammatory markers. How amazing is that? We used to only do that in research, and now we check our patients to see if they have inflammation in their arteries, specific markers that can be taken care of, so then we can stop that oxidative stress, stop that plaque formation, and actually encourage plaque regression. That means plaque melting.
We are just like firefighters putting fire out from your arteries.
And I always say, I'm the firefighter and you're the fire.
So we can do all this, and we're gonna take it in a way that everybody would understand how Dr. Varughese is practicing her medicine, and will help you to understand. And please give us send us questions so we can answer if you don't understand something. But we were trying to be as simple as we can to really help everybody out there to understand how to take care of themselves.
That's right, it's really important. So we are located here in the Woodlands, Texas, and in Houston we have an office, and we have an office in Conroe. So that's a small part of the world, right? So you may not be here in Texas, or you may not be here in the Woodlands. Ask your doctor about coronary artery disease and tell them to follow us, just like you're following us. So maybe if they don't know the specifics of these things, they can also find out. We love educating people. I think education is the best thing that we can do with our life, because that sustains life, improves life, makes it better. So we're gonna wrap it up, because we have lots of patients to take care of today, and we are gonna take care of you the next time when you follow us on Live the V Life with Dr. Annie.
The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.